Good morning. This is me, Nafisa. Today we'll be understanding about mucoactive drugs, also called as mucoactive agents or mucoactive medications or mucoactive medicines. Mucoactive medicines are used for productive cough. Productive cough is also known as wet cough. Productive cough in Hindi is called as balgam wali khasi. Mucoactive medicines are classified on the basis of their mode of action. Four main classes of mucoactive medicines are mucoregulators, mucolytics, mucokinetics, and expectorants. Let's learn about each of them. Mucoregulators, as the name suggests, are medicines that regulate mucus secretion or medicines that decrease mucus hypersecretion, either by their anti-inflammatory and antioxidant action, or by anti-inflammatory action, or by reducing mucus secretion, and the fourth way is by regulating mucus production, or I can say as reducing mucus production. Anti-inflammatory and antioxidant action. Let's understand how. Anti-inflammatory means provides relief from inflammation or reduces airway inflammation or reduces swelling in airways, so makes breathing easier. Antioxidant means provides protective effect. Where is this protective effect seen? On the respiratory cells. Examples are N-acetylcysteine and ambroxol. Ambroxol is the active metabolite of bromhexine. Medicines that are anti-inflammatory or antioxidant do not have direct effect on the airway mucus secretion or mucus production, but they reduce inflammation. As you know, inflammation is the first step that leads to more mucus secretion and more mucus production. Hence, if anti-inflammatory medicines are given, then the first step itself is blocked. So further steps of more mucus secretion and more mucus production will not take place, and hence mucoregulation. Another way by which medicines act as mucoregulators is by having an anti-inflammatory action. These medicines reduce airway inflammation, therefore making breathing easier and regulates the mucus production. Example is corticosteroids, molecules of which are prednisolone, budesonide, macrolide antibiotics, molecules of which are roxithromycin, azithromycin. Other examples are theophylline and acebrophylline. Medicines can also act as mucoregulators if they reduce mucus secretion. If mucus secretion is reduced, therefore reduces sputum volume. Example is anticholinergics, molecules of which are ipratropium and tiotropium. Medicines can act as mucoregulators if they regulate mucus production, that is, ensures normal mucus production. Examples are corticosteroids, molecules of which are prednisolone, budesonide, macrolide antibiotics, molecules of which are roxithromycin and azithromycin. Mucolytics are medicines that lyse the mucus or breaks up the mucus or thins the mucus or reduces the elasticity and viscosity of the mucus. Examples are bromhexine, ambroxol, N-acetylcysteine, serratiopeptidase, trypsin, chymotrypsin, and bromelain. Mucokinetics are medicines that increase mucus kinesis. How? By acting on the cilia. Another name for kinesis is movement. Hence, mucokinetics are medicines that increase the movement of mucus by acting on the cilia. Where is the action of cilia taking place? In the airways. Therefore, what is the result? Increases mucus clearance in the airways, or I can say as increases mucus clearance in the respiratory tract. Summarizing, mucokinetics are medicines that increase mucociliary clearance. Examples are bromhexine and ambroxol. Expectorants are medicines that expel cough or medicines that induce cough. How? By hydrating the mucus, or in simple words, increasing the water in the mucus. Hence, the volume of mucus increases. Also, water content will thin the mucus and will decrease the adhesion of the mucus, that is, reduces the stickiness or loosens up the mucus in the airways. Because of these reasons, excess mucus is easily coughed up. Hence, will clear congestion resulting in easy breathing. Examples are guaifenesin, Most commonly used expectorant, sodium citrate and ammonium chloride. Thank you so much. Stay blessed.